blood glucose summary. The food we eat has absorbable portion which consists of carbohydrate, fats, proteins, vitamins, minerals and water, and non-absorbable portion, the example of which is fiber. Now if you look at the bottom of this slide, minerals and vitamins do not form significant portion of our food by weight, so we will not talk about them. Examples of carbohydrate in our diet include rice, potatoes, wheat. Examples of fats include butter, oil, lard, margarine. Examples of proteins include meat, poultry, milk and milk products, pulses, legumes, beans. One thing we must understand here, that there are very few pure foods, means there are very few foods which will have carbohydrates only or proteins only or fats only. Most foods have overlapping carbohydrates, proteins and fats. To give you an example, wheat has carbohydrate predominantly, but it also has proteins. Meats have proteins, but it also has fats. So except for things like sugar, which is pure carbohydrate, or butter or oil, which is pure fat, note that most foods have more than one type of food that we eat, more than one classification of food that we eat. There are not many pure carbohydrates, proteins or fats. Almost all the carbohydrates that we eat and some of the protein and fat from our diet get converted to glucose and circulates in our blood as glucose, causing normal blood glucose levels. Now this is a very good example. It is from Wikipedia and it shows here in the red is the, or in the brown is the blood glucose level. So this is breakfast, this is lunch and this is dinner. So when the person eats breakfast, the blood glucose level goes up, and along with that, this in blue is the insulin level. So the insulin level also goes up. This insulin pushes this glucose into the cells and thus brings back the blood glucose levels to normal. Same thing happens at lunch and dinner. So this is the action of insulin, that when the blood sugar is or blood glucose is rising, to bring it back down to normal. If for any reason, if this insulin was not there or was less, this blood glucose would have risen and would have stayed up here. In the center of this picture there are two curves. One is a dotted one and the other one is non-dotted. The dotted curve shows that if you eat a food which causes sudden rise in blood sugar to a much higher level, then insulin also rises to a much higher level, and then the blood sugar or glucose comes back to normal. The continuous line is an ordinary food and the dotted line is a food which causes sudden rise in blood sugar levels or blood glucose levels. This relationship between glucose and insulin maintains our blood sugar within the normal range. Now our body consists of many systems. There is a cardiovascular system, there is a gastrointestinal system, there is a nervous system. Each system has organs in it. So our say gastrointestinal system has liver in it, stomach, intestine, colon. So and each organ is made up of many small units called the cell. Cells are so small that they cannot be seen by naked eye. Even 1 gram of our tissue of our body has millions and millions of cells, so the cells are so small. Cells need glucose to function properly and to survive. So this is a cell and it is next to a blood vessel, and the blood vessel has blood in it which has glucose which came from our food. This glucose need to enter the cell that the cell can function properly. That's easy. Now at the cell wall level, about where it shows a brown circle, something helps the glucose enter the cell, and that something is called insulin. Insulin is made in pancreas, which is an organ in the upper part of our abdomen, and when there is lack of insulin or absence of insulin, then this glucose cannot enter the cell and the levels rise in the blood like a back pressure. When these levels become 126 mg/% in fasting state or more than 200 mg/% in a random state, in a non-fasting state, we call it diabetes. The symptoms of diabetes therefore are because of high blood glucose levels and low levels of glucose inside the cell. We will talk about these symptoms in details in the presentation called Essentials of Diabetes. Under that, look for symptoms of diabetes. Now, what are the normal blood glucose values? Please don't confuse these with the diagnosis of diabetes. We saw that for diagnosis of diabetes, one should have a fasting blood glucose level of 126 mg/% or more, and the normal values we saw were below 100 mg/%. So if you see here, in a non-diabetic patient or a non-diabetic individual, the fasting glucose level should be below 100, and 2 hours after eating meal the level should be below 120 mg/%. In a patient in whom the diabetes has already been diagnosed, who is already on medication for diabetes, the fasting blood glucose level should be below 120 mg/%, and 2 hours after eating meals it should be below 140 mg/%. Now, diabetes is not a yes or no type of condition. What is a yes or no condition? Pregnancy is yes or no condition. Either you are pregnant or you are not pregnant. Malaria is yes or no condition. Either you have malaria, you don't have malaria. Pneumonia is a yes no condition. Either you have pneumonia, you don't have pneumonia. Diabetes is a range where below 100 is normal blood sugar, 100 to 125 is pre-diabetes, 126 and more is diabetes. So it's like blood pressure or cholesterol reading. It's like a scale, and depending on where one is on that scale, the diagnosis of diabetes is made. A person who is not diabetic today can become a diabetic after a few days, and a person who is diabetic and who is on some medication may end up becoming not being on medication with his diabetes controlled just by diet or by diet and exercise, or even the diabetes can just go away for a time if the diabetes had come because of a stress on the body like infection or pregnancy. So what I'm trying to say is that diabetes is not like cancer. Either you have cancer, you don't have cancer. Diabetes is a sliding scale. You can go in and out of diabetes depending on your behavior, depending on your lifestyle. Now, A word about glycemic index of the food, because it is related to glucose levels. Some foods, when you eat them, the glucose level can rise suddenly and significantly, and these foods are said to have high glycemic index. As a diabetic, you should avoid foods with high glycemic index. There is another term called glycemic load, and glycemic load is the total amount of glucose load when a food is eaten. We have discussed both these terms in much more detail in the presentation called Diet and Diabetes. Problem with glycemic index and glycemic load is that these terms are applicable to carbohydrate part of the food only. So meats and fats, they have a low glycemic index because they do not cause increase in blood sugar, but that doesn't mean you can eat a lot of fats or a lot of meat and nothing will happen. And that is why a better approach is to take care of the glycemic index of the food and also of the calorie count of the food, because the calorie count comes from all the three types of food that we eat: the carbohydrate, the protein, the fats. So when you are eating diet as a diabetic, take in account both these factors. Now, what are the symptoms of high blood glucose? When the blood glucose is high, what symptoms happen? Earlier we saw when there is lack of insulin, the glucose levels increase in blood and decrease in the cell. These symptoms are discussed in detail in the presentation called Essentials of Diabetes under the heading Symptoms of Diabetes. To summarize, once the sugar reaches above 180 mg%, it is excreted from the kidneys in the urine, and since it cannot be excreted as powder, it takes a lot of water with it, causing mild dehydration, which leads to excessive thirst, and the person drinks a lot of water. High blood sugars also cause increased chances of infections, delayed wound healing. Even the smallest wounds like paper cuts take a long time to heal, and high glucose levels also cause changing vision. Again, this is in very brief. For details, please refer to our presentation Essentials of Diabetes. Under that, look for Symptoms of Diabetes. What happens when the glucose levels become low in the blood or in the cell? There is excessive hunger, palpitation, sweating, weakness, tiredness, inability to focus or concentrate, abnormal behavior even like a psychiatric patient, loss of consciousness, and even seizures, coma, and death can occur. All these symptoms of low glucose are explained in detail in our presentation called Low Glucose Levels or Hypoglycemia, Significance, Identification, and Corrections in the Right Way. That's a very important presentation. Please review that presentation. Now, this slide may look little complex, but I would like you to focus to the rightmost column, where in the white it says fats break down to form fatty acids when there is starvation or when blood glucose is low. And the importance of this one is that when fats are converted to glucose, a byproduct is created, and that is acids, and these acids in excess can be toxic. They can be toxic to the heart, so the heart cannot beat properly. They can be toxic to the brain, and very high levels of these toxic products or acids can even kill the patient, can cause unconsciousness, and can cause a lot of problems. This is discussed in detail under the heading Diabetic Ketoacidosis under the presentation short-term complications of diabetes. It's a very important topic and it's a very important point, but I would like you to understand here that when there is starvation or when there is low blood glucose because of any reason, then the body tries to produce glucose from fats and proteins. From proteins it is very little, but from fats, if the conversion to glucose is too much and for a long time, then a lot of acid can be created, and the acid that is created can be dangerous to a person's well-being and life. And again, this is discussed in detail under diabetic ketoacidosis under the presentation short-term complications of diabetes. Same point that I mentioned earlier. If you look at the top, it says when there is low cell glucose, and the cell is written in white to emphasize. The blood glucose may be high, but if the cells are not getting glucose because of lack of insulin, the body imagines that there is no glucose and behaves in the same way that we mentioned just now. So the body believes there is no glucose in the blood because the cells are not getting it. So the body pushes its different components or parts like liver and muscle to break down fat to form more glucose, that the cells can get glucose to function properly. Now a word about blood glucose testing versus A1C. When we check fasting blood glucose, it gives a glimpse for 1 second out of 86,000 plus seconds in a day. So a patient's morning blood glucose levels may be perfectly normal, but there may be very high or low afternoon, evening and night levels, and that is why it is important to do an A1C test, which gives an average of the blood sugar readings in the past 3 months. And we have discussed this in detail in the other part of this presentation under the heading A1C. So testing for A1C along with daily blood sugar testing will help address this problem of not knowing the whole picture about the patient's blood glucose level for 24 hours a day, 7 days a week.